Hey everybody, and welcome to Autism Awakening, the podcast that helps you help your child with autism. I'm Dr. Jared Skowron, and we're recording this live on a Facebook Live event. So if you ever want to take part in our podcast recordings, just come on over to our Spectrum Awakening Facebook page, Thursdays, 12:15 Eastern Standard Time. I take my Thursday lunch, and we talk with you about something autism and different biomedical ways that you can help. So we are at the end stretch of a podcast mini-series for 2024. And we've been talking since the beginning of the year about all the different medical things that affect your child with autism. We first started with why does your child get autism, and talked about genetic issues and different infections and toxins that can affect brain development. We then got into balancing neurotransmitters and neurochemistry. That led us into a really important part about mitochondria. And mitochondria do a lot in our body. They produce energy, and a lot of parts of our body need energy, especially the immune system. And when we start to have dysregulated immune systems, especially in the gut, we're predisposed to getting infections, and it's hard to get rid of those infections. Those cause different issues, and that kind of spirals down into other behavioral effects. Then we talked about hormones last week. We talked about diets. So we talk about a lot of things. Where we're going to talk about today is more immune system issues. So you see how this immune system podcast has taken up a good third or 25% of what we're talking about, because the immune system is a huge dysregulated part of autism and why it's happening. So today, the part of the immune system that we're going to be talking about is autoimmune conditions, all right? Specifically, the autoimmune conditions of PANDAS and PANS. So we're going to review what those are, why those happen, and of course, what we can do about it naturally. So let's first talk about autoimmune conditions in general, because I want to kind of help you guys understand that, and then we'll lead into the specifics with autism and PANDAS, PANS, etc. We'll also get into a little bit about folate receptor autoimmune antibodies, so we'll touch on that as well. So, number one, autoimmune medical conditions. There's many of them. And basically, what it is at the core is your immune system is attacking your body. That's it, okay? There's a part of the body that your immune system attacks. For instance, I've got an autoimmune condition. Hey, I'm 50 now, and I'm getting this arthritis in my thumb, okay? That's actually my immune system attacking my joint, causing inflammation, and now, frankly, I've got pain and my thumb clicks all the time because that joint has been enlarged and the bones are growing from the inflammation. So, again, down at the core, an autoimmune condition is the immune system attacking a part of the body. Now, there's other autoimmune conditions you might be familiar with. Hashimoto's is a super common thyroid problem that causes a slow thyroid, a hypothyroid, because our immune system is attacking our thyroid. Lupus is another common autoimmune condition where the immune system actually attacks the nucleus of our cells. It seems to affect the kidneys first and then affects other downstream effects of the body. So what we're worried about with autism is the immune system attacking the brain. So this is what we're going to get into today. Now, how does this happen? And how does this happen with the condition of PANDAS and the condition of PANS? Now, first, let me define what those conditions are, because frankly, they're just acronyms, and medicine loves its acronyms. PANDAS stands for the Pediatric Autoimmune Neuropsychiatric Disorders Associated with Strep Infections. Okay? That's a whole lot. I'll explain it in a second. PANS is the Pediatric Acute Onset Neuropsychiatric Syndrome that's not related to strep, all right? So acronyms all aside, what does that really mean? What it means is autoimmune conditions can be triggered by infections, all right? Autoimmune conditions can be triggered by infections. How this happens is that sometimes the part of our body looks like an infection. It looks like a bacteria, it looks like a virus, it looks like Lyme, it looks like whatever, and our immune system gets confused. Imagine that someone committed a crime and the police were hunting for that person, but that person had an identical twin. And the police caught someone and said, hey, you did this crime. We saw you on camera, someone who looks exactly like you. But that person says, I've got an identical twin. It wasn't me, it was the other person. Well, the police may go after both of these people because they look the same. And this is what we're dealing with when we talk about autoimmune conditions triggered by infections. Now, a very common example in this is those of you who may have heart disease and go to the dentist, you may be given antibiotics every time you go to the dentist. Now, the reason is some people with heart disease, their heart valves look like strep infection. And so if you accidentally get strep infection from the dentist, your immune system kicks up, it destroys the strep, but then it starts attacking your heart valves and your heart function gets worse and your heart disease gets worse. So this is a kind of common example in the dental world or the cardiac world for many people where, hey, I understand there's this autoimmune association between an infection and worse medical symptoms because my immune system confuses the two, attacks the strep, attacks the heart valves, boom, I get worse symptoms, okay? Excuse me. So that's what we're dealing with PANDAS and PANS. So again, let's take PANDAS for instance. What happens is our kid gets a strep infection. Hey, kids get strep throat. Strep goes around, all right? Our body attacks the strep bacteria, kills it off, which is great, but then confuses the strep infection with the brain and starts attacking the brain, okay? Shout out to Reem. Reem said, what's the best treatment for PANS? We're going to get there, Reem. Don't you worry. And I got a lot of science to back it up as per usual. So PANDAS is strep infection. The immune system attacks it, kills it, gets confused, attacks the brain. PANS is practically the same thing, except it's not from strep. It's from something else. Maybe it's from a virus. Maybe it's from a parasite. Maybe it's from whatever other infection. The immune system gets confused, attacks the, let's just say virus, and then attacks the brain. All right. Now, first off, diagnosing these is really, really, really difficult because there is no objective test that shows that you have PANDAS or that you have PANS, right? All that we can test for are markers of the immune system attacking infections and attacking the brain. So those tests do exist. So you might, for those of you who deal with PANDAS, you might be testing your strep antibodies often. You may have tests for the immune system looking for antibodies against different viruses. There are tests out there that look for antibodies attacking different parts of the brain. So those tests do exist, but we really don't have any kind of scientifically determined understanding of what of that is normal and typical and what of that is out of range. So again, as an example, if any of us got strep throat and we did our blood test, we would have antibodies to the strep bacteria. They'd be there. We just fought strep. Doesn't mean we have PANDAS. It just means, hey, we encountered strep. And those antibodies will last for a decade, okay? And that's the immune system's response. That immune system is now stronger against that strep bacteria. So we can say, hey, look, I'm immune to strep, or I can readily fight strep. So it's really hard from a medical standpoint to look at this immune system response, to look at these antibodies and say, okay, you've had strep, obviously, because you have antibodies, immune system response to it, but that response is old. Versus, hey, you have an immune system response and it's flaring and active now. So determining that is pretty difficult, and it takes some kind of clinical look and say, yeah, I think this is an issue, this is not an issue. So this is where the diagnosis is really hard. In my clinic, and again, I've been biomedical autism doc for 20 years. I've got a telemedicine clinic. I help kids all over the world. What I see clinically, and I think this is the most important thing for you to determine, does my kid have PANDAS and PANS or not? And the key symptom is, how does my child do after a cold? Okay? Period, right there. How does my child do after they have a cold? All right? Now, during a cold, our immune system is revved up and we usually have typical symptoms of a cold. Oh, I feel tired. Oh, I feel cranky and I have a fever and I'm just kind of out of it. Okay, my behavior is abnormal. But once the cold is gone, the clinical symptom that determines PANDAS or PANS is my behavior after that cold. All right. So after a child has a cold, if their behavior returns back to typical, back to what it was before the cold, you probably do not have PANDAS or PANS. Okay. However, if after a cold, your child's behavior is astronomically worse for weeks to months after that cold, you probably do have PANDAS or PANS. And let me explain why. All right. When we have a cold, our immune system revs up. Good, that's its job. Got to fight the infection, whatever it is. Let's say it's the flu, right? So our body revs up the immune system. We kill the flu virus. But when the immune system is ramped up, all the immune system responses are ramped up. Okay, and that can be autoimmune conditions, that can be PANDAS and PANS, that can be food reactions, food allergies, food sensitivities. When inflammation is raging, it's across the board. All right, it's across your whole body. Nothing is spared. So that's the key thing I want you to look at. Hey, my child had a cold, my child had a flu, and you know what? After that, they were typical, probably not PANDAS or PANS, but after that, they were dramatically worse. Yes, probably PANDAS or PANS. Okay, so that's kind of the symptom of understanding. And again, there are tests out there, there are blood tests out there that look for antibodies to the infections, that look for the antibodies to the brain, but there's nothing really concrete right now. Okay, you can run them and get an idea and kind of go from there. But again, I want to go based on that symptom. So the question is, what do we then do? So let me kind of talk across the board about what we do, and then we'll get into some details and some scientific research, all right? I want to break this down into two parts, okay? Part one, when you have an acute cold, and part two, after the acute cold, okay? Now, when you have an acute cold, all right, what I want you to encourage your child's body to do is to kill that infection. Kill that infection, add a bunch of antimicrobials, all right? Whether they're antivirals, antibacterials, antifungals, kill that infection when you have a cold, all right? Try not to use anti-inflammatories, all right? If you add anti-inflammatories, you're gonna decrease inflammation, you're going to decrease the immune system's ability to fight these infections. So if you want the infection to go away fast, no anti-inflammatories, just kill the bug. Period. So during cold, lots of antimicrobials. Now, many people don't like to see their child uncomfortable. Many people are afraid of fevers, and they give anti-inflammatories. And frankly, those anti-inflammatories make you feel better because they stop the inflammation, which improves the symptoms, but the infection's still raging and it's still there. That's why many people will take anti-inflammatories like ibuprofen, hopefully not acetaminophen, everybody. Throw that stuff out. And you'll see improvements. Your child will be like, hey, I feel better for 6 hours, but then I get worse. Why? Because the infection's still there. The immune system's trying to kill it. All right? So if you have any anti-inflammatories, whether that be over the counter, whether that be natural, try not to do it during the cold. Just use antimicrobials. Hopefully 3 to 7 days and you're done. That's part one. Okay? Part two is after the cold. All right? After the cold, the acute infection is gone. And now we're dealing with this inflammation in the brain and all the symptoms from that, okay? So at that time is when we need to really boost on the anti-inflammatories because we're not dealing with the acute inflammation attacking the cold, we're dealing with the residual autoimmune inflammation attacking the brain. So anti-inflammatories, go after the cold. We also want to do other antimicrobials after the cold as well. Because part of this autoimmune condition is, as we explained, it's the immune system confusing an infection and part of the body, in this case, the brain. And sometimes that infection might still be lingering, all right? We're familiar with our kids' guts. They often have candida, they often have mold, they often have bacteria, they often have parasites. They're still there, and the immune system may be continuing to attack it, okay? The immune system may also have stored different infections in your tonsils, in your adenoids, in your lymph tissue, and your body is still attacking those remaining infections that are still there and attacking the brain. So post-acute infection, post-acute cold, we go for anti-inflammatories and antimicrobials. This is also, as a side comment, why taking your tonsils or adenoids out seems to help a lot of kids with PANDAS and PANS. And I've seen it in my clinic a lot, and I often recommend it. If you've got a lot of PANDAS or PANS, talk to your ENT about taking the tonsils out, taking the adenoids out. It usually helps. We've definitely had people where it has not helped, and in my opinion, it's because that infection's somewhere else in the body. It's not in the tonsils and the adenoids. It's hiding somewhere else. Who knows? Who knows? And it's really impossible to figure that out. As another side comment, from a pharmaceutical standpoint, a lot of people with PANDAS or PANS get IVIG infusions, okay? IVIG is just an infusion of immune system antibodies, all right? It stands for intravenous immunoglobulins. Intravenous immunoglobulins are injected immune antibodies that boost up that immune system attack killing those bugs, all right? So post the cold, kill the bugs, and anti-inflammatory. During the cold, just antimicrobials, all right? Let's get into some science to back this stuff up. All right, first off, we've got post-infectious inflammation, autoimmunity, Sydenham chorea, PANS, and PANDAS, all right? So just right there, I love the title of the research study, which says post-infectious inflammation, as we discussed. Autoimmunity, autoimmune system attacking the brain, PANDAS and PANS, and Sydenham chorea. Now, side comment on Sydenham chorea. Sydenham chorea is a medical condition that was defined years ago, decades ago, last century for sure, that surely has very similar symptoms to PANDAS and PANS. Okay, the term PANDAS and PANS is a pretty recent medical term. In fact, a lot of doctors don't believe it exists. A lot of neurologists don't believe it exists. Some do, some don't. But if you talk to them about Sydenham's chorea, if you talk to them about St. Vitus dance, which was described hundreds of years ago, they're very similar symptoms. All right. And frankly, I think they're very similar, if not the same medical condition. It's an autoimmune condition that's triggered by an infection, period. Okay. That affects the brain. So here we have Sydenham's chorea, PANS, PANDAS. These conditions are associated with a range of autoantibodies, which are thought to be triggered by infections, okay? These autoantibodies are thought to cross-react with neural antigens and modulate neuronal activity and behavior. PANDAS lack clinically available, rigorous diagnostic biomarkers, as we discussed, but there is accumulating evidence supporting the role of inflammation in these conditions, okay? So just like we talked about, post-infection, you've got these antibodies, they attack the brain, they cause inflammation, all right? What symptoms are you going to get? Primarily behavior, okay? A lot of behavior problems. I've got a patient of mine who has one kid with autism and one neurotypical kid with PANDAS, and she said, I would take the autism every day because there's so much stress and so much day-to-day behaviors to deal with PANDAS. It's a lot. It's a lot, okay? So here's another study talking about the clinical features of PANS, from sleep alteration to brain fog. PANS and sleep disorders represent one of the most frequent manifestations of PANS, involving 80% of patients. 40% had ineffective sleep, 58% had fragmented sleep, 47% had limb movements, another almost 80% were diagnosed with tic disorder. So again, the major symptoms you're going to see of PANDAS or PANS is going to be off-the-wall behaviors, right? And motor tics, okay? Now, motor tics can be your stimming. Motor tics can be just head movements. Motor tics can be as severe as seizures, all right? So a lot of people, not a lot, but there is a subset of people with PANDAS and PANS that get seizures as a symptom of the neuroinflammation, okay? So again, what do we do about it? It's a combination of antimicrobials and anti-inflammatories, all right? Now, over-the-counter anti-inflammatories, if you've listened to us before on Spectrum Awakening, we do not like acetaminophen. Internationally, that's paracetamol. Brand name Tylenol, brand name Calpol. No, period, okay? And somebody just made a comment a little bit ago asking if it depletes glutathione. Yes, acetaminophen, paracetamol deplete glutathione, which opens the blood-brain barrier, exposing it to infections and toxins. So no, we don't want that, all right? So a lot of you may be giving ibuprofen, which is great and safe for certain dosing by weight and certain duration. The problem with long-term over-the-counter anti-inflammatories is it's going to give you an ulcer. All right, it would give anybody an ulcer. So you can't take that stuff long-term without destroying your gut. So what do we do instead? We move over to natural anti-inflammatories, which you can use long-term. Again, as a caveat, if your child gets a cold, stop the anti-inflammatories. All right, let the immune system kick that bug's butt so you can then take care of it regular. All right. So the first one I want to talk about is something we created a while ago, our Panda Bear supplement, okay? Panda Bear is one of the best natural anti-inflammatories on the market, and the active ingredient is palmitoyl ethanolamide, okay? Just rolls off the tongue, doesn't it? So what we've done, there's palmitoyl ethanolamide on the market, obviously, but it doesn't taste good, okay? We made a tasteless powder. So Panda Bear is a tasteless powder of palmitoyl ethanolamide. We also threw in a little bit of vitamin A, vitamin D, vitamin E, and vitamin K because it's a fat-soluble substance, so you can't mix this in drinks. You have to mix this in food, all right? So let's get into the research on palmital ethanolamide, which is, again, the acronym is PEA, which you'll see in the research studies. Palmital ethanolamide keeps neuroinflammation within boundaries. It has been demonstrated that the increase of palmital ethanolamide is able to keep neuroinflammation within its physiological limits. That's pretty cool. Pretty cool starting research study. All right, let's get a little bit more detailed to our kids. Palmital ethanolamide and autism. Palmital ethanolamide is proven to be effective in controlling inflammation, depression, epilepsy, and pain through a neuroprotective role against glutamate toxicity. This is going back to our second podcast in the mini-series, guys. Neurotransmitters, glutamate. We got to take care of this stuff, all right? PEA supplementation reduces overall autism severity by improving language and social and non-social behaviors. Modulation of immune system response, neuroinflammation, neurogenesis, neuroplasticity, mitochondrial function, and microbiome activity is all improved with PEA. All right, pretty cool research. Again, I love showing this research because I hear too many conventional docs say there's no research on autism, there's no research on natural things. It's here, everybody, all right? It's here, and it has been for years. That's why we focus on the science in our podcasts. All right. Next, the beneficial effects of palmital ethanolamide on expressive language, cognition, and behaviors. These are two case reports. One child who took palmital ethanolamide had expressive language and overall autism severity as measured by CARS improved significantly. Another child displayed noticeable and rapid improvements in cognitive behaviors and sociability on one natural supplement, guys. All right. Hey, how about another one? All right. This is an animal study, but we got to start somewhere. Palmital ethanolamide counteracts autism behaviors in mice. PEA has been extensively studied for its anti-inflammatory effect. PEA reverted the altered behaviors of these mice. However, PEA was able to restore hippocampal signaling, that's part of the brain, improve mitochondrial dysfunction. Furthermore, PEA reduced the overall inflammatory state, and the analysis of gut permeability showed a reduction of leaky gut. Reduction of leaky gut, better microbiome, better mitochondria, less brain inflammation on this stuff, okay? I want you guys to try it. If you think there's inflammation in your kids, if after a cold their behaviors go cuckoo nuts, all right? Try it, all right? Now that's just one anti-inflammatory. We're gonna go with some others. Again, I also want to discuss, as we did before, it's not just anti-inflammatory, but it's continued, chronic, persistent antimicrobial, all right? Antimicrobial treatments. So, substantial improvement of autism with treatment for polymicrobial infections. Polymicrobial infections may have contributed to neuropsychiatric symptoms in autism. Targeted antimicrobial treatment resulted in improvement in cognition, such as learning disabilities, focus, and concentration, neurobehavioral, such as oppositional defiant, antisocial, disordered mood, immaturity, and tic symptoms, okay? So again, what this is showing in this case report with a real kid with autism, this doctor gave multiple antimicrobial treatments, maybe antibacterial, maybe antifungal, maybe antiviral, and showed the improvements in our kids, okay? Now, we've talked a lot about different anti-mold and antifungal treatments. We've got our yeast mold bundle, which is extremely popular, whether that's colloidal silver or grapefruit seed extract. We also have other supplements like our biosillin and our paraslayer, other different natural herbs that are going to kill these things. What I wanted to focus on today was vitamin A, okay? Vitamin A is an amazing antiviral natural treatment, okay? It's part of the World Health Organization's treatment protocol for measles, period, and has been since the 20th century, all right? Vitamin A is amazing, and many of our kids improve on high-dose vitamin A treatment. So, our vitamin A supplement is called Vira Clear. So I highly encourage you guys to get on vitamin A supplement, one of these a day. These are actually little soft gels. Okay, so sometimes, they're super tiny, right? Sometimes kids will chew the soft gels. I'm gonna have one. Sometimes you can cut it open with like a knife, and it really helps a lot of our kids. We've had a lot of comments just this year alone on the Facebook Lives about it. So let's get. Hi, everybody. Welcome back. For those of you who are on live, my video froze, a little Wi-Fi connection issue, but we're back and hopefully good to go. So let me go back to where we were to catch everybody up who is listening live. We discussed the anti-inflammatory PEA, palmital ethanolamide, showed some great research studies in that. Now we're moving over to antimicrobials, and the antimicrobial we're going to focus on is vitamin A. And we showed our ViraClear supplement. Now let's get into the research on vitamin A and autism, okay? Here's research on vitamin A and autism. Vitamin A deficiency has been reported to have a major impact on the gastrointestinal function of children with autism, while vitamin A supplementation has shown to improve the symptoms of autism. All right, so not only do we need vitamin A for autism and our brain development, but we also need it for our gut and our probiotics and our microbiome. All right, here's another one. Vitamin A improves the symptoms of autism. I mean, how much more obvious of a research title do you need than that? Vitamin A improves the symptoms of autism. Serum retinol is a technical term for vitamin A. Serum vitamin A levels in children with autism were significantly lower than in controlled children. After vitamin A supplementation, the children with autism exhibited significant improvements in autism symptoms. How about that? Live shout out to my buddy Rob, who's listening from Rhode Island. Hope he's doing well. We're trying to plan a little fun for his brother-in-law. Next, vitamin A supplementation program alleviates social impairments in children with autism. And I believe this happens because it improves oxytocin. All right? What's oxytocin? Oxytocin is our love hormone. Oxytocin is that hormone that makes us feel love. It's the one that's released during delivery of your child, as long as you're not, put on pain meds, right? If you go through that naturally, you experience this huge love connection to your child because of oxytocin. So vitamin A improves social impairments, potentially from the oxytocin. Pretty cool stuff. All right. Another thing to do, we've talked ad nauseum about folinic acid. And of course, I love our superfolinic acid because it's the only product on the market I've seen that includes cofactors that enhance folate receptor activity. So here's a research study, and I got to give shout outs to some of my favorite docs. This is recently published this year. Of course, Dr. Fry, one of the great research in the autism community. And of course, those who are familiar with my telemedicine practice, Dr. Erica Smith is starting to publish some great research studies on autism. And of course, she sees patients with me. We practice together. Folate receptor antibodies in PANS and PANDAS. This data, for the first time, demonstrates that PANS PANDAS is associated with folate receptor antibodies and suggests folate metabolism abnormalities may contribute to PANS and PANDAS symptomatology. So what do? You give folinic acid. So you guys should be taking your Panda Bear, should be taking your vitamin A with the ViraClear, should be taking your folinic acid, okay? Another popular anti-inflammatory is, of course, curcumin, right? So we've got a great curcumin product. We combine it with serratiopeptidase, which helps it affect. And there's a lot of curcumins on the market. We're trying to make something a little bit better. And of course, all our products gluten-free, dairy-free. Curcumin works with a lot of kids. Doesn't work with everybody. Some kids get a little behavior issues when they're on curcumin. Others don't. As say it's like a 90-10 or an 80-20 balance. So most kids do well on it. But curcumin is amazing as an anti-inflammatory because curcumin treatment restores brain neurogenesis and improves autism behaviors. And this is an animal model, but we're improving brain cell development, neurogenesis. Curcumin treatment improved autism-related symptoms in mice, enhancing sociability, reducing repetitive behaviors, and ameliorating cognitive impairments. Guys, the science is here. We just need to try it, all right? Last thing I'm going to discuss is something that you probably haven't heard of. This was actually one of the three first supplements. It was one of the first three supplements of Spectrum Awakening. When Spectrum Awakening launched 10 years ago, we had Power and Focus, Calm and Cool, and a supplement called Trehalose. Now, Trehalose is a disaccharide. It's actually used as a baking ingredient, okay? And you can get it, can't usually get it at your regular supermarkets, but you can get it online, you can get it on Amazon, you can get it at kitchen stores. Trehalose is a disaccharide that cleans up garbage in the brain, okay? And our body takes food and takes air and takes water and creates good things, but we also produce waste products. The body's got to clean it up, put it in our urine, put it in our stool, okay? And trehalose helps get rid of that garbage in the brain. Now, years ago, I gave a lecture at Autism 1 about trehalose and about, again, these waste products in the brain that need cleaning up. And Alyssa actually says, thank you, my daughter has mTOR, so let's just jump right into it. mTOR is part of this cleanup activity in the brain. And that mTOR cleanup activity in autism and in Alzheimer's and in Down syndrome doesn't work very well, right? So one of the natural ways to support that cleanup when mTOR is not working well is with the disaccharide trehalose, all right? So let me get some research studies here to show you. And actually, before I do, I performed, and I never published, a small clinical trial on trehalose. And within 45 days, we had an average of 20% improvement on the ATAC with kids just taking trehalose, all right? So here we have abnormal mTOR activity associated with pediatric autoimmune neuropsychiatric conditions and autism. Again, PANS, PANDAS, and autism is affected by this mTOR, all right? Here's another one, this abnormal mTOR signaling in autism. Data shows the mTOR signaling pathway is abnormal in Sydenham's, chorea, and PANDAS. These are the neuroinflammation conditions that occur with autism, all right? And again, I don't need you to, I'm not going to get into the science of mTOR, but mTOR cleans up the brain. So if you can't clean up the brain, then you're going to have neurological conditions, autism, PANDAS, PANS, Sydenham's, chorea, all right? And how do we improve that? We improve that with trehalose, okay? So here we are. Trehalose augments neuronal survival via the mTOR independent activation, okay? So trehalose is going to make your brain cells last longer and survive. Last one. Not only is it going to improve cleanup of brain waste, not only is it going to let your brain cells survive, it also is an antiviral. I'll say that again, an antiviral, right? Trehalose inhibits cytomegalovirus infection. Hello. It's amazing. It's amazing stuff. Cytomegalovirus is one of the top viruses associated with PANS. Okay, remember, PANDAS is strep, PANS is everything else. And cytomegalovirus is one that's often tested. And when that level is high, we want to kill it. We kill it with vitamin A, we kill it with ViraClear, we kill it with trehalose. Awesome stuff, guys. All right. Oh, that's all of our science for today. So let me kind of sum up and then we'll get to some live questions. All right. Inflammation is a problem. Okay. Inflammation in the brain of our kids with autism is extremely prevalent. That inflammation can be from an autoimmune attack. Our own immune system attacks the brain. Why does it do this? It's trying to get rid of something. Okay. Many autoimmune conditions are triggered by an infection. Okay, the immune system sees the infection and sees the brain as identical twins, attacks the infection, and then attacks the brain. So what do? All right, number one, we have to split this up into two parts. Does my child have an acute cold? If they have an acute cold, kill that bug. Don't use anti-inflammatories, just use antimicrobials, antivirals, antibacterials, antifungals, whatever, all right? Once the cold is over, kids with PANDAS and PANS have extreme behavior flares, sometimes motor tic flares, sometimes seizures. You don't have to have seizures to have PANDAS or PANS, but the extreme cases do. We should probably post, I did a news segment on NBC years ago about PANDAS and PANS. We'll see if we can dig that up for you guys. But once that acute infection is gone, lots of anti-inflammatories and lots of antimicrobials, all right? You can do over-the-counter anti-inflammatories short-term, but don't do it long-term because you'll get an ulcer. But I love our Panda Bear. This is a fat-soluble form of palmitoyl ethanolamide, completely tasteless. Mix it in any kind of food you want. A lot of great research on PEA. Vitamin A is fantastic. Our ViraClear supplement, a lot of people swear by this stuff as well because we're killing viruses. This inflammation of PANDAS and PANS is going to affect the folate receptor. So add a little folinic acid as well if you're not already. Another great anti-inflammatory is curcumin. This is our curcumise product. It's a combination of curcumin and serratiopeptidase. And the last supplement that I haven't talked about yet, you can only take this if you can swallow pills, okay? If you open your pills and mix powders into stuff, do not use this. The taste is absolutely horrible, okay? This is our product called Neuroimmunity. It's an amazing combination of anti-autoimmune herbs, things like andrographis, black cumin, cordyceps, and a little bit of curcumin. It's an amazing combination of herbs that is going to help with reducing autoimmune issues. But again, it tastes absolutely disgusting. This is a capsule. You have to swallow this capsule. All right. So that's a great place to start with PANDAS and PANS. And as I mentioned before, and please try to do it, if you can get your tonsils out, if you can get the adenoids out, if you can get IVIG, do it. Do it. PANDAS and PANS is a bear, okay? I mean, pun not intended, but it's a bear. All right, here's a coupon for the weekend. You can use PANDAS20. It's going to get you 20% off any of our supplements, any of our lab tests on SpectrumAwakening.com. That expires March 17th, 2024. If you want one-on-one help, go to our website, click appointments. You can book an online telemedicine appointment with me, and we can get started. I can order lab tests, put you on a treatment protocol. We are here to help. All right, let's get answer to some live questions. I saw one just come up, talk about the size of the Neuroimmunity pill. I'm going to say this is mid-size. This isn't a huge pill, but it's not a small pill. So I'm going to go with a mid-size pill size on this. Well, I take this as well. Why not? Oh, it's just my excuse to drink some tea. All right, let's get to some of the live questions today. Live questions. Here we go. Live shout out to Michelle. She's here on time. You know what, Michelle? So was I. Me too. I often am a few minutes late. Mayor from Ohio has a panda son. Kay, Natalie's grandmother from Kentucky. She's always here. Armando's always on. I hope Enzo's doing well. Alyssa, do you recommend anything other than Panda Bear? My daughter always gets ear infections when we use it. Even had a ruptured eardrum on it. Yeah, again, because that stuff isn't rupturing the eardrum. What it is was there was a mild ear infection going on. When you suppress the inflammation of the body, it was able to rage, get worse, and then the side effects of ear infections happen. She was sick, didn't know at the time, we had to stop the supplement. So again, I don't want you guys to use anti-inflammatories when you're acutely ill. Sometimes you know you are, sometimes you don't. Lindsay, hey there, a few quick questions. Anything you can recommend to detox an infant after getting vaccinations? Yeah, we're going to have our detox podcast next week. So we'll definitely talk about that. But after vaccination, no acetaminophen, and I would take vitamin A, okay? You want to ramp that immune system up. And then I would take binders, all right? I would just take binders, get stuff out of your body, binders and vitamin A. Supplements for kids who are humping everything going through puberty. Yeah, we talked about it last week. Where do I have it? Our pregnenolone supplement. Here it is. Try pregnenolone calm, okay? And we did talk about this last week in our hormone podcast. So you go back and watch that and look, kids going through puberty are going to touch themselves, and it becomes kind of a behavioral technique like potty training. Here we go to the bathroom in this room and we touch ourselves in this room, and then you add on sensory issues to that, and kids are going to do it more. All right. Is it common for a child to vomit on super serotonin? No. Try it with food. All right. Diane, live shout out. Reem says, what's the best treatment for PANS, which we got into. And let's see. Reem, my son has SB100, is over 300s, PCP recommended brain MRI. What do you think? I don't know what they're looking for with the MRI, but, I love testing. The more I know, the more I can help. So if you want to get an MRI done, at least it would rule out something. And so take a look. And he's talking about his strep antibodies, I believe, but I'll say this. Not only do we see strep antibodies high, but what I test in a lot of our kids when we do blood work are measles antibodies, measles, mumps, rubella antibodies. Normally the mumps and the rubella antibodies are typical post-vaccination. The measles antibodies are often charts higher than the lab machine can test. All right? And what does that mean? That means the immune system is still attacking this. There is still massive inflammation going on, and I'm really concerned about this. Caroline, is anything for pica in an autistic child? Yeah, minerals. You just want to give minerals for anybody who has pica or pica or pickled peppers. I never know which way to say it. We've got, do I have it here? Yeah. Hold on a second. We've got a mineral powder, detox mineral replacement. It's a great combination of things I can't quite read because my eyes are 50 years old. But it's got calcium, magnesium, zinc, selenium, copper, manganese, chromium, molybdenum, potassium, boron, and vanadium. So it's a nice mineral replacement. Really the only things it doesn't have in here are iron and iodine, which you could take separately. All right. Sheik wants a translation in Hindi. If you know a way I can do that, I'd be happy to. Karen, unfortunately, we've been battling PANS infections and mold triggered it. Inflammation is a beast. I know. Just hammer the antifungals, hammer the anti-inflammatories. Brianna, can you explain dyspraxia and what helps it? Well, we'll briefly go into it. I think I should have a whole podcast on dyspraxia and apraxia. I think what we need to do with that is for any kind of speech disorder, we want to balance neurotransmitters. That's where the Skowron solution supplements come in handy. But when we have problems with the motor function of our mouth, I want you to support mitochondrial function as well. So try our Mitomax supplement and the Skowron solution. Rodney's always on. Good to see you, man. Yesenia, yes, my son has flared after COVID. We're going 6 months. And I'm glad you brought this up. COVID's a virus. And you know what? I've seen lots of COVID-induced PANS, or at least PANS flares induced by COVID, because a PANS flare is going to be induced by any cold, all right? Any kind of inflammation is going to worsen autoimmune conditions. Brianna, do you think retainer primitive reflexes cause a lot of issues in our kids? The severe kids, yes, but not our high functioning or moderate kids. Also, red light therapy, is it beneficial? Well, red light therapy is supposed to help with mitochondrial function. I haven't read enough research or talked to enough parents who have benefited from it to support it yet, so I'm kind of in that neutral category right now. Alyssa, not so much bad behavior. My daughter gets separation anxiety and abnormal worries, massive anxiety. Yeah, sure. I'm going to throw that under the behavior category, whether it's fight or whether it's flight. Okay, and anxiety is flight. Beth, my kid was recently on antibiotics and antifungal for yeast and C. diff, diagnosed via modified oat test. Once he was off his antibiotics, his speech dipped and he started stimming more. It's almost a regression. Is this something you would see in a kid? I would see that in any kid who stops their antimicrobial treatment too early. You just got to keep going, okay? Go for the natural stuff, all right? Go for that. Grab our yeast mold bundle. Grab the biocillin. Keep at it, Beth. All right. Susan, acetaminophen depletes glutathione. Yes, yes, and yes. Don't forget, for you internationals, that's called paracetamol. Gada, what about alpha chymotrypsin as an anti-inflammatory? I've never used it. I've never had any patients use it. So again, I'm going to put it in my neutral category that I'm just not familiar with it. I'm not going to throw anything under the bus like most docs do. They're like, well, I've never seen it, so it can't be good, right? I'll be neutral. Alyssa, my daughter was 23 weeks and dealt with chronic infections. Looking back, we trusted the doctors. We never realized the frequent antibiotics causing inflammation and made her worse. Well, that's because it's going to screw up your microbiome, and that's why when you take antibiotics, you should take probiotics, or at least a fecal transplant. Just wait, guys. 20 years from now, fecal transplant's going to be changing your kids' worlds. Just takes science forever to get there. Mike, thoughts on Hellman therapy to help PANDAS and PANS? So I've used Hellman therapy on a few kids, never saw improvements in those kids. But again, it was only a few. It's not like I did it on 100 kids. It was only like, it was 5 maybe, and I saw no change on them. So I don't want to say it would never work because it's got to work on somebody, but nobody that I ever saw. Alyssa said, adenoids and tonsil surgery was my biggest regret. Not only did my daughter hemorrhage, she shot up in weight, and sleep apnea is worse. Definitely research before you make the decision. Well, Alyssa, I'm really sorry. Tonsillectomy and adenectomies for the majority of my patients have always been great. That's never 100%. And, the fact that she hemorrhaged, I don't know what happened during the surgery. Obviously, you want to make sure you have a good surgeon through a pretty common procedure. So I'm sorry that happened. Alyssa, how can you tell the difference between a regulation stim and a motor tic? My daughter's been a happy flapper. I like that term. It's like very 1920s since she was a baby. So a flappy stim is going to be voluntary. I did that. I did that because it made me feel good, okay? I'm watching the Super Bowl. I'm getting up and flapping, All right, it's conscious. A motor tic is something that's really out of my control, and I don't really know that I'm doing it, and it just kind of happens. It's not really voluntary. So I hope you could see that, see me make the difference, but that's how I would define the difference. All right, Win, my son absolutely has PANS and have been on ViraClear, a miracle to say the least. Tics are gone 12 hours after starting ViraClear. I gotta stop there. Win, thank you for that shout out. I mean, this is what I need from you guys. I mean, I love helping you guys. I love helping you help your kids, but you gotta spread the word, okay? There's millions of families out there that don't know there's help for them, and they're gonna believe you, all right? So what Win just said is 12 hours after ViraClear, the tics stopped, but anger continued. Any other suggestions? I would try the Panda Bear if you haven't yet, Win. Thank you very much. You're the best. Thank you, Win. Hey, you guys are the best. Any parent who's trying to help their kid, man, I got to give you guys a shout out because there's too many parents who give up. There's too many parents who say, nope, put them in a home, put them in therapy. I'm done. Family gets a divorce. It's sad. It's sad for you guys. It's sad for the kids. So you're trying. So shout out to you guys. What I didn't mention, Win, that I wanted to, and I'm glad you brought it up, the anti-inflammatory diet, gluten-free, dairy-free, is really going to help this post-infection inflammation because if your body's ramping up inflammation against the brain or against infections, it's going to do it against food as well if you've got food sensitivities or food allergies. So this is where being strict on your diet is really important in PANDAS or PANS, okay? And those foods are different for everybody. Kay says, what's good for ulcers? Okay, glutamine. All right, I want you on 10,000 milligrams of glutamine a day. All right, you get that anywhere over the counter. Also, if you like food, cabbage. Get a juicer and juice a head of cabbage a day. Mix it with a couple apples so it's sweet. That'll take care of your ulcer. So good. All right, moving on. Elise, what about mold illness in kids? Do you see speech? You say progress? I'm going to think you mean regress. Yeah, any kind of infection can cause regressions. So we see a lot of mold. We did have a podcast on mold last month. I would go back and listen to this. Armanda is sharing. Thank you. Brittany, our 8-year-old doesn't eat anything we can mix PANDAS, so we use a syringe. Love it. That is awesome. PANDAS is everything for us. Yeah, it doesn't dissolve like other supplements because it's not water soluble, period. Michael Phelps. The Michael Phelps. How long would Panda Bear take to kick in? We did it for a week and didn't see much. I tell everybody try everything for like 3 to 4 weeks. Spectrum Awakening has a 30-day return policy. So, 30 days, you try something, it doesn't do what you want, your kid doesn't like the taste, send it back for a refund. Spectrum Awakening would rather you try something and send it back than not try it at all because there's too many things that can help. So, Mike, I would say like 2 to 3 weeks. Margaret, can we take Panda Bear supplement with medication that doctor recommends? Yeah, I don't see any drug herb interactions with palmital ethanolamide. Aza, my 6-year-old eats, chews, then mashes every food in his hands. Yeah, those sensory issues are so fun. They are so fun to deal with. Looks like this is when my videos start to froze. Hey, Chris is watching. I hope Emily's doing well. Chris, have we updated hormone tests on Emily? Because I really want to check into that stuff. Anyway, we'll touch base. Jeff, my kid has dark brown spots on his legs that won't go away. His feet are sometimes yellowish. I'm very concerned about internal bleeding. Serious, okay? Jeff, listen up. Get on some vitamin C supplements. Where's mine? Get on some vitamin C supplements like our histamine C, but talk to your doctor about bruising. Go into your doctor and say, hey, he has nosebleeds every day. There may be some kind of clotting issue, medical clotting issue that you should get evaluated. Alyssa, can you take vitamin A when sick or should you avoid like Panda Bear? No, vitamin A is an antiviral. Take it when you are sick. I take it when I'm sick. Dominique, is the same thing with Jeff with the bruising. Chris, I got rid of my child's anxiety, depression, autism, blah, 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 blah. Chris is talking about somebody else. Tochi, do some kids tolerate methylfolate better than folinic acid? Some do. Yep. And that's why our Power and Focus supplement has a blend of folinic and methylfolate. So everybody's a little different, but they're very, very, very similar. Folinic acid will convert into methylfolate. Okay? Folinic acid converts into methylfolate. Yesenia, could we use NAC with Panda Bear? Yep. And Viragon? Yep. Do those help with OCD? It may. It may. Alyssa says, thank you. My daughter has mTOR, which we talked about the trehalose. Again, we don't carry trehalose. We used to, but we don't anymore. People just didn't know what it was, so they didn't get it. But you can get it on Amazon. You can get it at a kitchen, a baking store. And it's sweet. It's a saccharide. It tastes sweet. Lena, thank you so much, doctor. You are amazing. You're welcome. I'll keep helping. You keep sharing. Rayleigh, we'll check on this. Thank you. My son is sick since October. High white blood cells and CPR. Positive on autoimmune. Benny, superfluinic acid shouldn't be used alongside with power and focus. It can be. It depends how much flinic you can handle. Okay, some kids can handle a little flinic. Some kids take more. Some kids take 15,000 or 30,000 micrograms of flinic acid a day. All right, so putting in 2,000 isn't too much. You can use them together. Scarlett, what are your thoughts on glutathione injections for autism? They're great for detox. Win. Win. Wow, also noting that he's more behavioral with curcumin. I would just stop it. If your kid gets worse behaviorally on curcumin, just stop it and switch to a different anti-inflammatory. Alyssa says, I can help so many kids, so many Smith-Kingsmore syndrome kids with this. I would love to. Erica, my 13-year-old daughter has autism, significant feeding difficulties, aggression, behaviors, anxiety, sleep disturbances. She takes fluoxetine, which doesn't help. I rarely see it does. Clonidine, which doesn't help. I need to bring her to you. They just keep prescribing meds. And that's what docs do. Okay? I go to the mechanic, they fix my car, right? I go to the barber, they cut my hair. I go to a conventional doc, they prescribe meds and perform surgery. That's what they're trained to do. You know, one of my patients went to a neurologist and said, hey, I need help, but I don't want meds. And the neurologist said, why are you here? And while that's dismissive, it's also frank and open and honest. Medical doctors prescribe meds, okay? You want something natural, don't go to the mechanic or to the barber or to a conventional doc. Go to a natural medicine specialist, all right? But yeah, Erica, set up an appointment. We'd love to help. Brittany, what supplement do y'all have that has trehalose? We don't, but again, easy to find over the counter. Donna, my child has PANDAS, but it keeps on coming. How long do I need to kill the virus? Months, if not years. Brannigan, hey, Dr. Skowron, I recently saw one of your posts about prenatal and calm. Sounds like it could be good for my son. How do we know it's right without testing? Try it. Try one a day and see if it helps. All right. Deb says phenol sensitivity. That'd be a good podcast. Deb says liver toxicity from too much vitamin A. No. Vitamin A does not cause liver toxicity. The only known side effect of vitamin A is 3 people had spontaneous miscarriage. So if your child is pregnant, there is a very, very, very minimal chance that they may have a miscarriage from vitamin A. Donna, can black seed oil reduce inflammation? Yes. All right. Sarah, hey doc, started Ben on Mitomax 2.5 weeks ago. It's made him hyper. Yes, reduce the dose. Cut that in half, see how they do. Dominique, can we open the capsules? My son will not take that pill. The curcumin, yes. The neuroautoimmune, no. I did that, man, I did that like a year or 2 years ago on a Facebook Live and I almost puked. It was so disgusting. Donna, watching from Kentucky, love everything you're doing. Thank you, doc, you're welcome. Rajesh, my son can speak, but his logical expression is poor and he can be bullied easily, so it's worrisome. Will he be okay with his age? Well, we're going to keep working, Rajesh. We're going to keep working on him. Lori, what's good for anxiety? Try our super serotonin support. Try our temper tamer. Try our spectrum tranquility. Deb, it's not behavioral. They have urinary pain. Yeah, urinary pain. Allison, what? And here, Goddess says trehalose may increase Clostridium. Only if you have it. Only if you have it. You know, so kill it. All right? Sugar is going to increase Clostridia, you know? And so it's this balance of starving infections versus killing infections. Allison, would ViroClear be helpful after active infection or during the active? Both. Donna, do you do testing for thyroids? Yes, we order standard blood work for thyroids. Karina, hi, PANS 12-year-old. Anything reduces nail biting? Everything we talked about. Panda Bear, ViroClear. Zuli, do those MMR titers ever go down if you give antivirals? How often do you test? Every 6 months? Evelyn, hey doc, any recommendations for seasonal allergies? Yeah, we talked about this a few weeks ago in another podcast. Try our Allergon and our histamine C supplements. Scarlett, is he live somewhere else as well? I'm Ron Burgundy. Sharjeel, how can you get your appointment? Go on our website, spectrumawakening.com, click the appointment tab near the top. You can book it online. It also has the phone number and the email of my clinic. All right. Madhu, how is stem cell therapy? You know, I get this question a lot, and I'll tell you the exact same response that was given at a TACA convention. So I was at a TACA conference a year and a half ago, and we were doing this physician Q&A panel. Somebody asked, blah, 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 stem cells. Every single doctor up there, 5 of the best autism docs in the world, said the exact same thing. Any patient we've seen on stem cells minimally improved for 3 months and then went back down to baseline. I wish it was better. Kristen, happy to be on one of these lives. It's smart to use binders during active infections? Yeah, I would. I think it'll help. All right. I'm going to get 2 more questions and we're going to stop because of time. CC Dennis, best thing to help an autistic child with severe food aversions? I would go with the Skowron solution and start there. Yeah, go with the Skowron solution and start there. Nada, my son gets so good on Augmentin and penicillin. Yeah, antibacterials. So go with the natural antibacterials. Try our colloidal silver, our grapefruit seed extract, our biocillin, our Paraslayer. Yeah, do it. All right, Priyanka, super serotonin before bedtime and 4 hours before, both are not making our daughter sleep the whole night. All right, so what I want to now do is we're going to go, if you watched our histamine allergy podcast, try that stuff. Try our Allergon and our histamine C before bed, see if that helps. All right, guys, one more question, we'll wrap it up. Maria, hey doc, I started my son on broad long train, positive on stool softening, but son curls up and just looks sick. Could it be a reaction? Yeah, I think he's really impacted. I want you to drop the dose down and let's go with this a little smoother. You can also try some mineral oil. Mineral oil you can get over the counter and it's going to make the stool really slippery. He might be holding on and he's trying to keep it in and that really hurts. Okay, he's just got to let it out. We got to train him out of that. All right, everybody, great podcast. Got to cut it short because of time, but let's review. PANS and PANDAS is an autoimmune condition that attacks the brain and is very common with our kids with autism. How does it happen? Most people think many autoimmune conditions are triggered by infections because the immune system considers the infection and the brain identical twins and they look the same. I kill the infection and now I kill the brain, right? So what we need to do from a natural perspective is give anti-inflammatories as long as you're not acutely ill and long-term antimicrobials, all right? A lot of great research on the supplement PEA, palmital ethanolamide, which we have as a tasteless powder in Panda Bear. That's an amazing anti-inflammatory along with our curcumes, but also give antivirals, which are so underutilized in medicine. And vitamin A, high-dose vitamin A is fantastic as an antiviral. Our ViraClear is great high-dose vitamin A supplement, And again, we saw research on how vitamin A deficiency is common with autism, and vitamin A supplementation improves autism symptoms and gut health. Gut health, everybody. All right. Love talking to you guys. Next week, we're going to be talking about detox. Coupon of the weekend is PANDAS20. Get you 20% off everything on SpectrumAwakening.com. Expires March 17th, 2024. If you want a telemedicine appointment, go to our website. You can book it right there under the appointments tab. And thanks for everything that you guys do. Thanks for helping your kids. Thanks for doing everything that you can. And we're here to support you. So have a great weekend, everybody. We'll see you next week. We're talking about detox. Bye-bye.